Kamya Rasayana is the persons who need a desire to have Prana Kama, Medha Kama or Shri Kama. Who desire to have health, we give Prana Rasayana. There are lots of Prana Rasayanas examples. Medha, those who want good intellect, good thinking capacity, concentration. That's the thing what we face, the cognitive problems in old age people. And Shri Kama, that's personality. And Naimittika Rasayana, direct for the disease. What we think, what we do for the disease, direct for the disease Rasayanas. Diabetes, we have lots of Rasayanas that have been mentioned for diabetes, nervous disorders like that. These slides were prepared as a general presentation, and after coming over here we understood that it's a research presentation. That's why I'm just running off from these slides. And Ajasriga Rasayana that we use in the daily life. Now we can take as Dr. Lebbing said, that it's the problem, the frailty we are facing, and so we have to give them what we say health, or prevent the aging, or give them a healthy life. So Vayasthabana Gana can play a good role in these things. And the 10 drugs that have been explained in Charaga Samhita, I have just listed out this, Amrita, Abhaya, Amalagi, Rasna and all. And out of these, some drugs which are available in Deutschland abundantly, no problem. And just indications of different rasayanas that can be used in frailty is Brahma Rasayana, Chavanaprasha. I have just given the indications. And the Medhya Rasayanas and the Lashuna Rasayana. Lashuna Rasayana is considered to be a good Rasayana for the Vata Rogas, and we have listed the combinations that Lashuna with Ashwagandha Churna is good. It has been given the indication for general weakness, and with Yashti Madhu Churna, speech disorders, which are also the things what we see in the old age patients. Yeah. And just some pharmacological properties of Rasayana drugs like Emblica terminalia cebula, that's taken from University of Madras. They are what they have found in their pharmacology, that antioxidant nutritive. We know that if we Google these drugs in internet, we can find that lots of properties comes out. Just I took one from the University of Madras. And the researches that we have found in Brahma Rasayana, it's a good research done by V. Ramanath and S. Rekha. That is, in cold stress chicken, it acts as antioxidants when the free radicals are generated in, and prevents the after effects of these things. And Vacha is a good Medhya Rasayana, explained in detail. And the contents of Vacha is alpha and beta acerons. And these alpha and beta acerons play an important role in the cognitive functions, and there are lots of researchers in Chinese, universities of China. They have done good works on beta acerons and alpha acerons, because this comes in their traditional medicine also. And the next study which I would like to highlight is the Centella Asiatica study on Centella Asiatica done in Manipal University, which is really interesting. They have found that the length of the dendritic processes are increased. But we have to look forward for this, because lots when this can be what we say possible, we have to contact them and we have to look about that. These are the collections of researches what we have done, and just few examples that I have cited here. And in aging, there are different theories of aging. Yeah, this is a Shuntek's theory of aging we have. He has stated the different stages of aging, that is childhood, and the important thing here is the vital maximum. We have to just keep in mind that according to Professor Shuntek, he says that the vital maximum age is the age where a person is at its optimum. And this age is best suitable for Rasayana therapy also. And as in Ayurveda also, we know that a process of aging, Ayurvedic concept, that is 0 to 10, we know all these things. And here I have to explain that the fifth decade and fourth decade. See, fourth decade is the Medha, intellectual development at its optimum. and 5th decade the complexion it is optimal, and from the 6th decade starts decreasing in the these are explained in the Ayurvedic classics. And now I'll just skip these slides because these are the involvement of doshas. What type of doshas? That is Vata, Pitta and Kapha. What are the lakshanas that are normally seen during the old age? And these are the modern classic clinical consequences and changes in the systemic analysis. Yeah, now I'll go for the practical approach, and now I would like to discuss what are the problems or how can we approach this thing here. That is, when we have started the department for Parkinson's and multiple sclerosis, the difficulties what are we doing? That is, first, the difficulties that we face is the availability of the medicine. That is, when we face a symptom, for example, a speech disorder, dysphonia, or dysarthria patients that are commonly seen in Parkinson disease, and what we have lots of formulations in Swarasada and all classics, and that are abundantly available in India. And what here we have tried with the external treatments like pichus and all. And I think that in India nobody will start with a piju for the first option for the as a piju for the speech disorders and all. But due to the inavailability of medicines, we started with these things. We are doing with these small little treatments and also the Shodhana therapies. And now there is availability of medicine is the first obstacle that we find in front of us to do this therapy, Rasayana therapy. That is, what type of Rasayana we get. Chavanaprasha is available, Brahma Rasayana, I don't know, that's a question, that it's available, we have looked for it. Brahma Rasayana is also available, but the other things, that is Nagabala Rasayana and other Chitraga Rasayana that we can include in the different Rasayana stages that are not available. And then the second is the palatability. Lashuna Rasayana is the best medicine for Vata Rogas in MND diseases, neurological diseases. It's very good for the development of the frailty. But what we have is the Lashuna. When we have explained in the classics, it's how to take the Lashuna Rasayana. It's very difficult for the patients over here to take it. Yesterday in the Dr. Reiner's presentation, I asked Dr. Reiner, he used to give Lashuna Rasayana for the patients, how he used to give, how he is giving. That is, he is giving in the extract form, and I have to look forward whether we can use that for Rasayana purpose. And the other is duration of treatment. Duration of treatment, that is, here the Krankenkasse pays for the patient a certain type of treatments and certain period of treatment. But Ayurveda treatment goes more about that. So it's also a difficulty how we'll plan the duration of the treatment and how we are going forward. We'll go forward with the total plan of the treatment at how many days, because we can't plan in Ayurveda that 3 days Rukshana, 4 days Svedana, or 5 days Snehana, and then because each and every day we see the Lakshanas and then we'll decide, now we have found the Agni Dibana Lakshana, Ama has been digested or Pajana has happened, and now we can start the Snehana stage and then the Svedana stage, and then it's optimum. Now we have to do the Shodhana stage. It's different, as we all know that it's each and every stage we have to daily observe, and what that we are doing here in the hospital. So these are the three difficulties. Of course, there are lots of difficulties. The ethical committee introducing Ayurveda drugs, that all comes afterwards. The first three difficulties to decide a Rasayana therapy as a research project. We are facing these things, and I think there will be a good discussion over these things. There are lots of experts from all over the world, from India, from Europe, and of course from the other continents. And So I think it will be a fruitful discussion for us so that we can develop what type of Rasayana for frailty we can do perform. Yeah, and this is the general thing what we have developed in Parkinson patients. What we are doing first, the patients anyhow we'll just start with Rukshana therapy, that is Amapajana Agni Dibana. We give this Churnas and Arishtas that are available in Deutschland, and the Ruksha Sweda processes in Swedana processes as a Kapahara treatment, and then we switch on to Snehana Swedana. Shodhana, we do mild Shodhana, as most of them are Vada disorders, and we know that Sneha Sweda Samshodhana Mrudu, and we do mild Shodhana, and that the Shodhana we do here is the Vasti Shodhana. That is, as we know, there are difficulties to do Vamana and Virejana in Germany for the patients. So we do Vasti Shodhana here. And Piyadikrama after that for Agni Vardhana, and then Rasayana treatment. The only aim is after, yeah, it's finished, last. This is the last slide. That is the only aim for, as Dr. Lebbing said, that lifespan is increased, but it's not a good lifespan. It is a disabled lifespan. The lifespan of disability, which is a burden for himself, that is ourselves when we get older, and for the society also. So we have to create health. That is, health is the, this is the definition from WHO and the Ayurveda, Samadosha Samagnischa Samadhatu Malakriya Prasanna Atmendriya Manaha Swastha Idya Vidiyate. So we have to look forward to create health, not just to remove disease. Thank you very much.
So thank you. So I think we have now a platform for discussing a few critical issues. I think the focus was basically on, how to define what is really authentic Ayurvedic treatment, and how do you, define it in a research setting, in terms of the diagnosis, in terms of the treatment. And I think I'd like to now invite questions. Yes. I'll respond to the first question regarding whole system, because I did refer to it in my talk. It's just, what I was doing was just raising this concern that, there are new concepts coming in the way Western medicine, sometimes the Western context, trying to understand systems like Ayurveda, and then you get force-fitted into those, definitions, and we need to be wary of it. I do agree with you that we could work towards redefining whole systems, but then, we are also, can't we think of the possibility of, looking at how Ayurveda would want to define itself, because Ayurveda says that it has its own definition, that this is Yukti Vyapashraya Chikitsa. Now, can we find a way of better interpreting this in a way that Western, scientific community can understand, rather than, evolving a definition, purely from a different context, and then trying to, because if Ayurveda did not have a way of, defining itself, it would have been fine. But we do have a category. We do have a label that this is Yukti Vyapashraya Chikitsa. I think the real challenge is that we should try to interpret what this Yukti Vyapashraya Chikitsa is in a format that would be more understandable to the scientific community. So I'm just talking about why don't we also think in that way. And the other aspect regarding authenticity, I would like to make a distinction between, real life practices and authenticity. What is important here is to pay attention to the real life practices. Let us not think about authenticity at this point of time. The place where, Ayurveda is actually being practiced, experimented, evolving, it is in the real life context in India that, Ayurveda is being practiced with a certain degree of freedom. And that is where we are likely to find the fuller potential of Ayurveda as it serves, in the clinical context. And we might also identify a lot of limitations of Ayurveda as we do it. But the whole idea is that we must shift our attention to real life situations.